Hong Kong's daily COVID caseload has stayed above 3,500 for the second day in a row. This comes as the hospital authority tightened COVID controls for staff who took after patients with a higher risk of infection. Joanna Ho reports.
From Monday, hospital staff handling patients with higher COVID infection risks, such as those receiving chemotherapy and radiotherapy, have to undergo PCR tests twice a week, on top of their daily rapid antigen tests. Authority Chief Manager Sarah Ho said the medics will receive specimen bags, which they must return to their hospital after doing the sampling at home. The aim is to enhance protection for patients and hospital staff. One more infection occurred at the palliative care ward of the Hong Kong Buddhist Hospital, taking the tally there to 8 patients and 5 staff members. A 98-year-old patient in the orthopedics ward at Queen Elizabeth Hospital tested positive yesterday. 3 other patients have since contracted the virus, and the ward has stopped new admissions and suspended visiting arrangements. The radiology department in Queen Elizabeth Hospital reported another infection, a doctor who is a close contact of a previous case. 3 schools were asked to suspend classes. In a 4th school, St. Catherine's International Kindergarten in Kowloon Tong, transmission in a school bus meant that 26 students who traveled in the vehicle will have to miss face-to-face lessons for a week. 7 school bus drivers and a nanny tested positive after having lunch together. Virus transmission was suspected in one bus, which carried 26 students from classes in the afternoon, after 2 students, the nanny and the driver, reported infections. This comes as the city added 3,574 COVID infections today, 216 of which were imported. Joanna Ho, HKIBC.